terrible. I was like, I didn't even think about ruining somebody's life by doing something like that. Like the last thing I would have wanted to do was to traumatize her. Calling her was just because she's kind of like my safe place. So being
Yeah.
able to talk to her.
She's your go-to if you're going to call somebody
Yeah,
usually.
yeah. If I ever need anything, she's
Yeah.
the one that's I can call.
Yeah. So we backtracked to your sister some and kind of how
Mhm.
she must have felt, but
Yeah.
let you take back off on what you were trying to say before that.
Okay. So once I'm in the hospital, I'm just kind of shocked about everything, and I honestly felt better afterwards. I was just on heparin. I stayed in the hospital for about a week. Um, my family went to go see me. It was very emotional for my mom because her dad had died of a stroke, but it was a hemorrhagic stroke, and he was very young whenever it happened. So she remembered
You tell me
being
like
little.
late 20s or something?
No, mid-30s, I think.
Mid-30s? So young.
And his was hemorrhagic, so
Mm-hmm.
that means he had a brain bleed. Mine
Hemorrhage?
was, yeah. And I think he had uncontrolled blood pressure, so I think that's what caused his. With me, it was a dissection in my artery, and then I didn't know at the time, but I would find out that I had a blood clotting disorder.
So dissection is the artery splits open?
Not all the way, because there's 3
Okay.
layers to your artery.
Okay.
And so think of a water hose with 3 layers.
Mm-hmm.
And so just the innermost layer is the one that had a tear in
Okay.
it.
And so the blood starts leaking out like instantly from there?
Well, what
How's that work?
happened? No, because we still have the other 2 layers. So
Okay.
what happened was, if you cut your hand, what's
Mhm.
going to happen is your body's going to attempt to heal that by forming a scab over it.
Okay.
And so that's exactly what happened inside of my
Okay.
body. But then it's like overdoing it because I have a blood clotting disorder I didn't know about. So
That's
it
what
actually
caused all of
caused
it?
a clot. Yeah.
Yeah.
Then I
What's that
wasn't.
disorder called?
The one that I have, there's very many different blood clotting disorders, but the one that
Yeah.
I had is called antiphospholipid syndrome, and it is a very
Say
rare
that 5
form.
times fast.
Yeah, very rare form of an autoimmune clotting disorder, and which
Yeah.
I already had autoimmune issues. Another thing that was so irritating about the entire experience was that less than a year before that, I had gone to Temple to Baylor Scott and White, gotten in with a hematologist, and I went in and I told her, "Look, I feel like I have a blood clotting disorder." And she said, "Why do you believe that?" And I told her, "Well, my first pregnancy, or actually, it was not even a year before. It was maybe a month before, because I had already had the miscarriage at this time. So I'd already told her, I was like, look, my first pregnancy, my kid didn't grow very well. He had uterine growth restriction, so I feel like that was maybe something with him not getting enough nutrients. So I don't know what was wrong. He didn't have enough fluid, had low amniotic fluid. And so, being in the medical field, you read all sorts of journals, all sorts of different things for continuing education.
Very scientific about your approach to it.
Yes, and so I had read about it just because I was curious. I'm like, these things, there's an explanation for everything. And I understand sometimes things happen, but I don't believe in coincidences, especially after everything that happened to me.
Yeah.
So I searched it, I looked it up, and I was like, look, I feel like I have a blood clotting disorder, and that's why he wasn't able to get everything he needed, because maybe there were clots in the cord, the placental cord, And so I told her that, and she basically told me, she was like, look, those disorders are a huge deal, and if you had it, you would know. And I was like, but I had a miscarriage, and I feel like that's what caused it, because the exact same thing that happened with my first pregnancy happened in my second, and then I miscarried at 12 weeks. And so I'm like, that's not a coincidence. You can't tell me it's a coincidence. And she just told me, you would know if you had a blood clotting disorder. She didn't refuse to do any type of blood work that I asked her.
She refused to? It bothers me about doctors, because I know they're very trained and they're doctors, but at the same time, you're a healthcare professional and you've researched it. And to me, why does a doctor care if you have extra blood work? Like, your insurance or you are paying for it. Why don't they just
At that point, I was prepared to take on, extra shifts at the time and pay for it.
Why would they care about doing a little extra round of blood work, even if it's 10 more tests? If you want it, why is their ego so big sometimes just to say no and treat you like they're stupid? Treat you like you're stupid. We went through that some with my daughter. Just the doctor had a God complex and just thought everything we were saying was just ridiculous. And just a lot of them treat you like dog shit. I know some really good doctors that don't do that, but your example is perfect. Why would you just not do the full spectrum of blood work that you wanted to do? Like, you had researched it, you talked to her about it,
Yeah.
and she said no.
Yeah, she said, no, if you had something like that, you would know, because those are bad, very
Yeah.
bad things to have. And then literally within the next 3 months, because I had a miscarriage maybe 6 months before, so it would have had to have been in the span of those 3 months leading up
Something's
to it.
causing them. Yeah.
Yeah, those 3 months leading up to it. And then I even told her, I was like, look, once you have one autoimmune disease, you're more likely to get more.
Mm-hmm.
That's usually what happens. You have one autoimmune disease, you have to be on the lookout for a whole array of autoimmune diseases because you're more likely to have them.
Yeah.
Usually people get 2 or 3 in their lifetime.
Mm-hmm.
They don't just come in ones most of the time, you know?
Yeah. Unfortunately.
Yes.
You get them all. You get all the autoimmune diseases.
I know, unfortunately, yeah. So she just completely blew me off. It just wasted my time because I'm like, I drove an hour and a half to
Where
get
was this
there.
at?
It was in Temple.
Temple,
In Baylor,
okay.
Scott and White.
Okay.
And so that's another thing. While I was in the hospital, I was just like, that jerk. I was like, I freaking told her, you know. It was
You're
the first
trying to
thing.
be proactive.
Yeah, I was like, the first thing I told her, I was like, I was right. She's a jerk, you know.
Did you get to talk to that doctor again?
No, I never went back there.
You're like, I want to tell you a few things right now. Like,
I
this
wanted
is one
to,
of them.
yes, I wanted to. I was like, look, you need to get some education. Like, whenever somebody comes in here, like, be more willing to listen.
Yeah.
And I feel like that's a huge problem with healthcare, is that people don't actually listen. And I do understand that some people are hypochondriacs.
Yeah, but probably more are not than are. So
yes, and then
give people the benefit of the doubt.
And being in my mid-20s and having a stroke, I understand that people didn't believe it. You know, it's not something that you see happen to younger people.
Yeah.
And then, but I'm like, I'm in my scrubs. Like, why would you assume that I'm doing drugs? And then I felt like maybe it was because I was a minority, and I tried not to make it about that, but I was just like, I wonder if that had a play in it.
Maybe.
As well.
Unfortunately, it could have.
And I'm like, I have my badge, I have my credentials, and why is that not enough?
Your badge says RN on it. Like,
yes,
that's no easy task to get that.
And then to add insult to injury, while I was there, you know, I called my provider, or the people I was working for. I had my husband call them the first time because I was obviously, you know, like struggling for my life. But once I was in the hospital, the week that I was there, I called my employer and I let them know, like, hey, they just told me I had a stroke yesterday. Like, I can't see anybody this week. I don't know when I'm going to get out. Because at that time I still had a clot, and I was just praying to God that nothing else happened. And literally that employer sent my supervisor, which I don't blame my supervisor. She was a very sweet lady. She brought me, I guess, roses or something, and she went up there and she made me complete a chart that I had been working on. That patient that I had seen in Coleman, he's like, we just need you to sign it so we can get paid for the visit. And I was like, are you kidding me?
It's so damn transactional.
Yes, I'm like, are you kidding
sickening.
me? I'm like, here I am in the hospital because I just had a stroke. You're coming in here telling me to complete the home health visit so you'll get paid for it, which I know is my job, but I'm just like, that is a lot. Yes. And then they told me, they were like, you have 2 options. You've only been with us, because at that time I had just graduated RN school. I had done my, you know, my my licensing exam, had passed that and had started working. And so they told me, they're like, you've only been here for, you know, less than 6 months, so you don't qualify for any kind of FMLA or anything. And so I'm like, okay, I understand that.
Almost holding it over your head.
Yes. And so they said, you have 2 options. Either we can fire you or you can quit. And I was like, well, put whatever you want, I guess, you know, I'm just like, shit. I could tell you I'm not going back.
First cuss word you said.
Sorry.
I've been counting mine.
Edit
There's
that.
no F-bombs. So I'm not going to edit it. It's
Okay.
supposed to be real. I dropped some F-bombs last night.
But I was just
I'm a little ashamed of it.
I just want to be like, okay, well, excuse me, like, I'm sorry that this
That is so
interfered with
shitty.
work, you know.
Like, yeah,
So
I had a major health incident. Sorry, you didn't get your billing.
yeah, so I was just like, it's one visit. Like, if your company is struggling that much, that one visit is worth
And they're not,
sitting.
because we know how healthcare cost is in the U.S.
And so
for multiple reasons.
I was so annoyed at that point, but I couldn't even be annoyed at her because she was like, look, they're making me do this, you know. And I was just like, I know they are, but it's
Damn it,
just.
Susan. What was her name? Oh, you don't have to say it. We can't say names.
And so it was just so frustrating. And I felt so devalued at that point too. They were just like, well, you know, we need to just go ahead and get you off the books because, you know,
What?
we're going to have to hire somebody else because I was the only
They're
RN.
tossing poop at you at that point.
Yes, I was the only RN in the entire area. And
The
so
rest were
without me,
LVNs?
there was none. There was
Wow.
none at that time.
Why
I
did they
think we
not
did have
place more
maybe one
value on
LVN.
it?
Well, and I was just like, you know, like, I'm sorry, but they needed somebody to see these patients. Like, I also didn't want them to go without care as well, you know,
Yeah.
so I understand that. But I told them, I was like, they were just telling me, like, what time or
Don't
when
judge
can
me.
you come back?
Pour
You
more.
know,
Don't judge me. I'm
I'm totally
listening.
judging you.
I'm being a great listener right now. Bourbon helps.
Yes. And yeah, I mean, it ended up, I don't even know if they put on there that I quit or I got fired. I don't really know.
Doesn't make a crap. Yeah.
Yeah, I was just like, either way, I was out of a job. So that was
Mhm.
fun to learn that while I was in the hospital. And then they were very like, we need to know when you're coming back. It has to be within this time frame because you only got this much PTO. And I was just like, look, I don't have time to be dealing with this or worrying about PTO. I was like, just forget it. Just go ahead and do what you're going to do. Because I'm going to tell you, it's going to take over a week for me to recover from this. I just had
Yeah.
a freaking stroke.
Yeah. They should know that.
Like, come
It's not even
on.
a 6-week thing. It's like, come on,
Like, it's
y'all. It's
gonna
gonna
take
take
a
some
little bit.
months.
Yes. And so I was just like, which I felt perfectly fine at that point. I didn't feel like I had any deficits.
Yeah.
Um, but yeah, we got that done. And then even just going through something like that, you learn who your friends are.
I bet.
My friend Mary, she is my best friend. I've known her since
How come
2012.
you never talked about her? I don't know if I believe you on the best friend thing.
Yes, she is my actual best friend.
You mentioned her name. I'm just giving you a hard time.
She is my best
I
friend.
don't know if you said that about her, but
No, yeah, yeah. She's my best friend for sure. She showed up to the hospital with an entire cooler of just drinks and snacks and stuff.
alcoholic drinks?
No, not alcoholic
I'm
drinks.
joking. You didn't have bourbon right after you had a
No,
stroke?
no, no. Yeah, they would have blood thinners and bourbon. That
Yeah, that's
probably
a
wouldn't have
great
been a good
idea.
mix. Yeah,
So how long do they, I meant to ask earlier, how long do they leave you on the blood thinner?
they left me on it for a week. They did imaging again to make sure that that blood clot had
Mm-hmm.
already, you know, dissolved.
Okay.
Um,
So what's the max they leave people on those? Is it a safe drug? Or if you take it for 3 weeks, it's going to cause other
Okay,
issues?
well, heparin, you can give it through a medication called Lovenox.
Okay.
And so those are
Is it,
injections that you
okay.
give, kind of like a diabetic, you give it
Okay.
in your, you can do it like in your stomach or
So
whatever.
it's like it's a carrier thing, like you inject that through Lovenox and that's how you get, like, how's that work?
Yeah,
I guess
yeah,
I
it
don't
has like
fully
a,
understand.
it has a, so it's just an injection that you give yourself, like in fatty areas, because it's not an IM
Okay.
or intramuscular. It's
Yeah.
actually, you inject it into like the fatty areas.
Okay. It's not
Kind of like,
intermuscular, it's through fat.
yeah, yeah,
Yeah.
it's subcutaneous. That's what it's called.
Yes. Yeah. Okay.
So,
So back to Mary. I derailed you.
oh,
Mary's
sorry,
awesome. She
yeah.
brought you a cooler full of non-bourbon drinks.
Yes, yes, a bunch of juice. She gave me my favorite pineapple juice, and I remember just being in that situation and then being stuck with somebody that doesn't care about you
He just
whatsoever.
sucked.
Yes, and then it's just
Yeah.
like, God, I just cried whenever she gave me that. Like, probably not to her face, but afterwards, I was just like, you don't realize how much you mean to people until they do shit like that, and
Yeah.
then it's just
You
like,
like you said, you realize who your true friends are. Like when you're in your
yes, yes,
crappiest, like shittiest, lowest place.
yes, yes,
Yeah.
and that was really enlightening to me. And then after being fired from my job, it was just like, why was I working so hard and why was I putting my entire
Mm-hmm.
life for this for somebody that would just replace me from
They
one day
wanted to
to the
get you off
next?
the books, and they literally told you that.
Yes, to my face. She told me that, and she didn't say it
She,
in a rude way. She was just kind of like, "Look, that's what they're telling
I,
me."
I know you said she
It's
was a
like,
sweet person, but her emotional intelligence has to be lacking to actually tell you that. and
Yeah.
phrase it that way. Like you're just a number. Like,
Yeah,
hey,
that's
we're
exactly
going to
how I
delete
felt.
your employee number out of our database, and
If
you're off our books for salaries.
Yes,
Like,
if
get
it
out of
were
here.
me, I would not have allowed that to happen, or I would have at least
Fight
been
for
like,
you.
yeah, it would have been at least
Like,
like, no, you're
have
not
some
treating
lady
my
balls.
employee like that. Let's wait till she's out
Yeah.
of the hospital, and then we can reevaluate the situation. But for
Yeah.
right now, hire somebody PRN or do what you got to do. But let's just wait on this, and that's not what happened whatsoever. And it wasn't until I actually, like after a week, I was able to go home. Like all of my family from Dallas came to visit me. My parents came to visit me. It was amazing to get to see everybody.
They
So
came to Abilene.
yeah, to
Yeah.
come see me. So
Yeah.
I felt really important that they took the time out of their day to come see me. So that was really, really good because we're all really, really close. We don't have tons of family here in the U.S. So it was really good to see them and the ones that are here to know that they support you. Like I don't see them all the time, but
Yeah.
best believe if
That's a
something were to
pretty
ever
good drive.
happen to them, yeah, I would be there and I would help them any way that I could.
I do like that about you. As we've talked, you have a really you have your main, like your brothers and sisters here and your mom and dad support system here, but you're really close, and it's pretty cool. I know you have a lot of family in Mexico, but it's nice to see close families that spend a lot of time together. And your
Oh yeah,
family seems kind of big too. Mine's pretty small, and we don't see each other that often. And part of that's my fault too, but they're a couple hours away. But it's nice that you have them, a lot of them, really close for you. But driving from Dallas to Abilene, that's a nice haul.
yeah.
It's very kind of them, and awesome that you have that connection. So your family in Dallas, are those like cousins or?
Yeah, they're my cousins.
Okay.
Yeah.
So you talked about not a lot of family is here. What ratio of your family that's close, like out to a cousin, I guess, as far as relation, what percentage is still in Mexico versus here, would you say?
Well, in my dad's family, he only has one other brother or two other brothers that are here in the
Okay.
States. And then my mom, she has no siblings that live here.
That's wild.
Yeah, so most of my family that is here is
Yeah.
from my dad's side.
Yeah.
And so those are the cousins that I'm referring to.
Does your mom feel lonely without her?
Oh yeah,
How
it
many
was really
siblings does she have
hard.
in Mexico?
Hopefully I don't get the number wrong. I want to say she has 4 siblings.
I won't know either way.
I'm like,
Your mom may watch this and judge the crap out of you.
yeah, probably.
What's worse than mom judging, right?
I know, don't show her.
Like my mom hated her. I'm slurring a little bit. Bourbon.
Wow.
3 drinks in.
Wow. Get it
4
together,
drinks in,
dude.
probably.
Get
Right.
it together.
Right. At least I'm in my house. I don't have to drive anywhere.
Yeah, exactly.
Where were we at before I derailed the crap out of this?
Oh, we were talking about me getting the boot while I was in the hospital, and then my friend being awesome.
You were talking about you being scatterbrained. Do you feel a little better now?
Yeah,
that completely derailed.
Compared to you, I'm like, oh, I'm on point.
You're not that scatterbrained?
Yeah, I'm not
All
that
right.
scatterbrained.
Proceed with what you were talking before I give us a 4.5 minute bullshit derailment.
Okay, so towards the end there, they did tell me, they said, which I wish that it would have been presented to me in a different way. Whenever I was about to leave the hospital, they recommended me going to a nursing home.
What?
Yes.
You're in your mid-20s.
Yes, and I was just like, am I going to a freaking nursing home?
No, I don't need a cane.
And I felt completely fine, but at this point, I had only been laying in a hospital bed.
Yeah.
But I would get up and do like physical therapy, and I was just like, whatever, I'm fine, So I didn't really feel like it was that big of an issue. I was very tearful at the time because I was like, I'm with somebody that's not supportive. He was pretty much pissed off the entire time. I didn't really know
like
why.
Like an inconvenience for him?
Yes.
Narcissist.
Like it was an inconvenience for him. And I just felt so bad. And I'm like, I'm about to have to go back to a house. We had just bought a house. It was ginormous. I was the only one that would clean it. So I'm like,
blanket? Is this?
Yes, it was a blanket. Yeah.
This is a blanket house?
We had animals.
Yeah.
And then we have a little kid, and I was just like, I'm about to have to start doing all this by myself.
He didn't help with any of that.
No, thankfully, once I did I denied the nursing home.
I gotta grab this stuff, feel naked again all of a sudden. It's a weird thing to say, isn't it?
Yes, you have to crop that part out.
No, I'm not going to. This is real shit here.
So I did end up going back home. That was just so depressing. So they did do like a welcome home thing for me. So that was nice. But they sent me home with a walker, and I didn't realize I really needed it until I left. And I was
You're
like,
like,
I'm
screw
so
this
glad.
walker. Now I need it.
Yeah, I was like, I'm so glad they sent me home with a walker. I didn't even think I needed it.
If they were going to send you to a nursing home, they had to give you a walker, right?
Yeah, exactly. Like at least don't fall at home,
Yeah.
And I really wish I would have taken the rehab part up. But they didn't really mention it as a rehab. They said a nursing home, and I think
Mm-hmm.
that's what skewed my mind on it. They actually do have a rehab center. I don't know if it was open at this point or not over there in Abilene. But I was like, that would have been really nice. And I feel like if I would have been approached in a different way, then it might have been more effective. But they're like, you
They
need to
said
go to,
nursing home and
yeah,
you're
like a
out.
nursing. I don't know if they said nursing home or nursing in rehab. I'm like, I don't know. All I heard was nursing home in my mind, and I was like,
You're
no.
like, I'm a quarter of a century old, not a century. I'm not
Yes,
doing
and I was
this.
just like, and then I was just like, how bad am I? I'm like,
Yeah.
this is really concerning. I'm like, I need to go to a nursing home. Like, what the heck? I didn't think I was that bad. And then so I was just like, okay, but I wish that if somebody would have got a pamphlet and would have been like, hey, so like you might have some deficits afterwards, and so like let's talk about your options, and then told me like, look, this is a rehab facility. They offer all
Yeah.
this type of physical therapy.
And,
Maybe you can benefit from that, so you can continue to get physical therapy, and your insurance will pay a certain amount. Like I
yeah.
feel like that kind of approach would have been so amazing. That's not what I got. It was well, we're thinking about sending you to a nursing in rehab, nursing home, type of thing. And it's just like, I'm not going
You're
there,
in a nursing home with 80-year-olds that are all trying to have sex with each other.
Okay, I didn't
Like,
want to think about that. I was just thinking just in
have
general.
you
If
heard
you're
about that though?
no, I
Apparently, it's a
mean,
thing.
yes, I've heard of it, but I'm like, I choose to view old people as all little angels. Okay,
Oh,
they are
didn't
sweet
I tell
little
you a
people.
story the other day about one?
No, about
I'll tell you off record.
okay,